Good evening, everyone. I, Dr. Ritika Dhiman, welcomes you all to these virtual discussions, Know Your Cervical Cancer, an initiative by Voice of Healthcare to mark Cervical Cancer Awareness Month. Today is the episode 2 of Know Your Cervical Cancer. In today's discussion, our leading experts shall share their insight on the prevention and screening strategies for cervical cancer. Before moving on to our discussion, I would like to welcome our eminent speakers for today. We have Dr. Hrishikesh, President FOGSI, Director Bloom IVF Group. Welcome, Dr. Pai.
Hello.
Also, I would like to welcome Dr. Chandrika Anand, Consultant OBGYN, Fortis Hospital, Nagarbhavi, Bangalore, who will moderate this interview today.
Good
Welcome,
evening,
Dr.
everyone.
Anand.
Good evening, everyone.
Over to you, Dr. Anand.
First of all, namaste, Dr. Hrishikesh 𝗬𝗖𝗲, sir. Thank you so much. I'm privileged to be moderating with you on a very important topic of cervical cancer in India. And thanks to Voice of Healthcare for giving me this opportunity. To the benefit of the viewers, globally, cervical cancer continues to be one of the most common cancers among females, being the fourth most common after breast, colorectal, and lung cancer. And unfortunately, the majority of new cases and also the deaths due to cervical cancer is very common in the low and middle income countries in which India is included. In India, the cancer of the cervix, uterine cervix, is third most common cancer with the incidence rate of around 18 per 1 lakh population of women, and the second leading cause of death with a mortality rate of 9.1%. As per the National Cancer Registry Program, cancer of the breast and cervix uteri is the most common cancer among females, and cervical cancer accounts for 6 to 29% of all cancers among women in India. 𝗘𝗽𝗶𝗀 district in the state of Arunachal Pradesh, India, had the highest rate of cervical cancer, that is 27.7% in Asia. Sir, please enlighten how important is the role of gynecologist in the diagnosis of cervical cancer.
First of all, I am the president of the Federation of Obstetrics and Gynec Societies of India, which is called the FOGSI. Just like IMA is the the main body, the FOGSI is the body of the gynecologists, and the gynecologists are the ones who come in direct contact with women. So I always say that we are the custodians of women's health in the country and in the world also, worldwide. But people are not aware of our organization so much as they are, for example, aware of the IMA, which is the Indian Medical Association. So we are, because we are in direct contact, we have the, directly related to women's health. Now, as far as the women's health is concerned, there are two important parameters when we look at women's health. One is mortality and one is morbidity. So maternal mortality is a very important parameter to gauge women's health. What are the levels of women's health delivery systems in a particular country? And in our good old days, our mortality following was 600 for pregnant women. So every 100,000, 600 used to die. Now it has fallen down because of lot of advancement to 97. So there are, in parallel with the pregnant related mortality, there is another mortality, and that is related to cancer. So one of the other killers in women are the cancer related mortality. So in that cancers in our country, for example, the breast cancer is the most common, followed by cervical cancer, oral cancer, colon, and other kinds of cancer, ovarian cancers and all that. But cervical cancer, especially in the lower strata of society, and is very high. So we have to focus on cervical cancer as far as the cancers are concerned. I always believe that we need to be holistic in our focus. So I personally, during my presidency now this year, I've launched the Badlav campaign, which is made up of three parts. That is ekikaran, that is integration. So whatever we do, including cancers, we should integrate our action. And then second is samanta, that is equality. And third is technology. So utilizing technology to implement integration and equity is very important for us. And in this national program of mine, cervical cancer screening and prevention and treatment plays a very important role.
So, as Sir told, the women, most of the women come to the gynecologist first, even if she has got a BP or if she has got a sugar, they will expect the gynecologist to be her primary caregiver, as Sir told. So, we are undoubtedly we are responsible for the women's holistic health. And FOGSI this year has launched a number of screening programs, making cervical cancer as a priority. So, coming to the second question, see, now we know India accounts for the highest number of cervical cancer cases in Asia, followed by China. Maybe thanks to the population, thanks to the lack of awareness and the preventive strategies, according to a Lancet study, India has got the highest number. Now, this research also revealed out of the 40% of total deaths from cervical cancer in Asia, 23% occurred in India. It is a well-known fact that 90% of the cervical cancer is associated with a viral infection called human papilloma virus. So all the sexually active women are prone to develop and HPV prevalence in India is for cervical cancers.
Hello. Can you hear?
Sir. Yeah.
So, can you just reframe the question because I
Sir,
lost the last 1 minute. I lost the last 1 minute of
no,
your
sir. What are
question.
the recommended screening methods for cervical?
Okay, so basically,
Nothing, sir. So like basically these women are. Yes, sir.
Hello. So I was just saying that
Yes, sir.
FOGSI has got various layers of cancer initiative is there. We are having program going on in the northeast where the prevalence is very high. Prevention program. We have got a training program for our own members. Colposcopy training program. Just now, as you are talking, we have launched a new 3-day training program for our members. So that's one aspect of it, the training program. The second aspect is to target our end audience, that is our patients. And from that angle, we need to do what is known as the biggest problem I feel in India is that the cultural problem is there. So simple examination of the cervix, per speculum examination, very people are very resistant to undergo that examination. Of course, when you do the examination, the visual examination of cervix and using acid to acetic acid is a very simple screening test which can be done by anywhere by any person, and it can be a good pickup technique for a dangerous cervix. And then we have the simple pap smear which has been there for many years now, more than many decades now, and that's called the pap test or the pap smear. And we now have a new test also called HPV test, which is it, as you said rightly, that HPV virus can cause also cervical cancer. So a simple HPV test nowadays, we combine both the test, pap smear and HPV test. But well, let me tell you, just now I did the Nari Swasthya Jan Andolan Yatra, where I covered for 21 cities over 5 states, and we also in that yatra did a camp also. Everywhere we went, we did about 150 patients, and we asked them there was a big questionnaire we asked them, and let me tell you, hardly anyone has done any pap smear in their life. They did the first time pap smear. So there is a problem of access. So first of all, there's a hurdle of awareness. Second hurdle is cultural. They don't want to undergo any vaginal examination. And third problem is a problem of access also. They don't want to do the test at all. So all these things are there. But coming back to this test, so before the age of 29 or 30, you should do the test once in 3 years, a pap smear and a HPV test. And between 30 and 65, you should do it once in 5 years. If you do only pap smear, you can do it once every 3 years. And after 65, you don't need to do any test. But in this time band of 20 to 65 years, that's the time when the highest chance of cancer can be there of the cervix. You should do the pap smear and the HPV test. But forget all that. Even simple per speculum examination is very important. So, many people feel, okay, if I do a pap smear and a HPV test is no. I was just now, about a week back, I was just chatting with one of my colleagues from the south only, from Tamil Nadu, and she was telling me that uh, she had a patient, 35-year-old. She came for a pap smear, and when she put the speculum, a very small, tiny polyp, like a small came out of the cervix. She took the biopsy of it. She did a colposcopy and a biopsy, and turned out to be adenocarcinoma. They were all taken aback. All the family was very perturbed, and she did a hysterectomy. She said, so she also agreed with it. She said, Dr. Pai, you are correct. Irrespective of whether you do a pap smear or a HPV test, you must also do a speculum examination. That is the basic test. We should not forget the speculum examination. I think, in fact, as a president, I want to start a movement to say, please do a speculum examination. Forget the pap smear and the HPV, which are in our country are the luxury, I would say.
Exactly. So what sir is telling is that all the asymptomatic women, whether they have any symptoms or not, once they are sexually active, they should start cervical cancer screening examination. They should go to the doctor, and once in 3 years, they need to get the per speculum examination and the pap smear. And if you are combining with HPV DNA, once in 5 years, and up to 65, after 65 years, there is no screening necessary, because whatever the damage would have, the HPV would have caused, by then it would have caused, not exactly, it may not cause so late. And also, Dr. Pai's message to all the gynecologists and all the doctors who are watching is that please do a per speculum examination for every patient who comes with any symptoms, any AUB or any other problem. Please do a per speculum. Don't skip that examination, because that is one of the most important examinations. That is a message for the young doctors. And also, the data shows that a lifetime screening prevalence is only 30%. As sir told, only 30% of women are getting screened for cervical cancer in India. The rest 70% are not aware about the screening methods.
Madam,
so, sir, I think the next question is, what are the... Sir?
Madam,
So
my mother,
what do you think are the main...
just to give you an example, my mother, my wife is a gynecologist, my son is a gynecologist, my brother-in-law is a gynecologist. My father was the professor of preventive medicine from Harvard. But my mother never did a pap smear in her life. So she, of course, she is no more now. Till the age of 87, 89, she never did. So the problem is also cultural, and I don't know. I personally feel that all of us, human beings, unless we are faced with a crisis, we don't act on it. So, prevention is better than cure. But in actuality, we all know that we should eat good food, healthy food, fiber-rich food, less glucose. We should go for a walk. We should do exercise. All that we know, but we never do it. You understand? Somehow the human body is not programmed to do voluntarily work. So we have to make it, we have to go out of our way to do it. So a health checkup is very important. And as I told you, my philosophy is of integration. So when you go to the gynecologist, she should do your blood pressure, she should see your BMI, she should do your blood sugar, your thyroid level, she should do a vitamin D. She should then examine your breast to look for breast cancer, look at your thyroid, do an internal examination, see if there's any tumor or something, do an abdominal examination, to just simple test if there's a tumor, ovarian tumor. So all of that should be done simultaneously. It's not that you are only going to do cervical cancer. You must check the woman holistically, and that checkup should be done once in a year. But chalo, if you can't do it once in a year, at least do it once in 2-3 years.
Okay. So as you told, sir, we are the primary care physicians. So often, even if a woman comes with a white discharge or a AUB, we do their breast examination and incidentally find a lump. And it so happened that so many of us have detected breast lumps way before the patient complained about it. And it has unfortunately turned out to be cancer also. So as sir told me, the patients have to check their social and cultural inhibitions, and the doctors, gynecologists have to treat the patient as a whole, screen for all the metabolic problems and height, weight, and also the breast examination, per abdomen and per speculum. Back to basics, sir. Messages.
And I forgot the sugar. Sorry, I forgot the sugar. So
yes,
if HbA1c should be, because we are the diabetic capital of the world. We are all going to be diabetics or potential diabetic. So earlier we catch it is better. So it should be a holistic examination.
Yes. So as you told, sir, one thing is creating patient awareness and creating awareness among doctors to examine is one thing. But how can women, all the women, reduce the risk of developing a cervical cancer? We know it is associated with HPV infection, but what lifestyle changes or what are the screening changes? What are the medications or vaccines you are going to recommend to reduce the risk of cervical cancer, sir?
Right. So the one of the things is prevention, and because of the HPV, so you must try to prevent HPV infection right at the beginning, because that is known to cause cervical cancer. Fortunately, what happens is that the cervical cancer is a slow process. So the cervix will first develop something called cervical interplasia, pneumoplasia, CIN we call it, 1, 2, 3. Then it will develop slowly. So it's a spectrum. So even if you can pick up a CN early, it's not cancer, but it's pre-cancer. We can treat it by using advanced technology like colposcopy and colposcopy directed biopsy or a leap or whatever. So
Correct.
but prevention, so HPV, so protection against infection using
Hmm.
protected sex. So unprotected sex is a dangerous thing. So using a condom is very important to prevent infection. Try, many people, if they have multiple partners, try to reduce the number. I mean, that's a
Correct.
moral moral issue or an ethical issue. I can't tell you as a doctor that don't have sex with that have sex only with one person. But if you are by any chance exposed to multiple partners, then it is important to be having a safe sex. So condom, female condom is also now available, or a male condom is supposed to be. You should use it, and
Yes.
of course you have to do the
Hmm.
HPV tests. And the before the age of 15, now it has been shown that if you vaccinate the girls, especially, there is a lot of people say that boys should be also, but that's a controversial area. But definitely less than 15-year-old girls between
Hmm.
the ages of 12 and 14, 15, you can give HPV vaccine, two shots at
Hmm.
6 months interval. And fortunately, this vaccine is costly, but now the government, we have, FOGSI also has recommended to the government
Yes.
recently that they should incorporate it in their national vaccination program. Once that happens, then government will procure the vaccine and give it to all the people free of charge, just like they did for the COVID vaccine. They gave it free of charge. So
Yes.
similarly, HPV vaccine, there's a move now to
Hmm.
see that it is incorporated in our vaccination program. Once that happens, all the girls will start getting immunized, and that will protect them against HPV vaccine,
Hmm.
HPV infection, and indirectly also protect them against cancer in the long term. Of course, the
Correct.
other things I told you, lifestyle is very important, but no one follows it. Trying to reduce your weight, stay within a normal BMI range of 18 to 24, 25. Then
Yes.
have good food, healthy fiber, less meat, Mediterranean diet, vegetables, green leafy vegetables, no smoking, no alcohol,
Agree.
exercise for 30 minutes. No one does all this. We
Yes.
are tell them, but who does it? Very few. So there are okay. My advice would be, try to do things in moderation
Hmm.
rather
Yes. So,
than telling people not to do it, because people are not going to listen. So whatever is in a plate. So one of the things my wife always tells me, so don't only take food once. Don't go and take one more time plate. So by doing that, automatically you would reduce the consumption. So all these are lifestyle things which also contribute to cancer risk.
correct. So, as sir is telling to all the public who is listening, please vaccinate your young children, educate them about sex early and multiple partners and healthy sex practices and using condoms or barriers, avoiding. And also, if you are doubting the sexually transmitted disease, promptly go to the doctor and get it checked. That also will go a long way. And quitting smoking also helps in prevention of. Cervical cancer. And one question, sir, because now all of us know because of the bad lifestyle, the cancer of breast cancer and cervical cancers are coming in early age group, that is in the reproductive age group. So even, and also the women are getting pregnant late. So pregnancy age has gone up from 25 to 32. Now it is going up to 40. Cancer prevalence also is coming down from 60 to 50, 40, and 30. So like now one very important question is, can cervical cancer occur during pregnancy? So how do you suspect a cervical cancer if in a pregnant woman? And if so, what are the protocols for its treatment?
So basically, it can occur in pregnant women also, but many of the time it may be asymptomatic. Sometimes, of course, you may have some bleeding coming in during pregnancy, and you would do a pulse speculum examination. But normally, we don't do a speculum examination as much. But I think maybe at least one, maybe simple in the early phase, one speculum can be done. But normally, if there's symptomatic only, then we would say, Acha, if there's a bleeding in the first or second trimester of pregnancy, you would put a speculum to see. If there is unfortunately a cancer, then most of the time, if the pregnancy is advanced, then it is better to deliver the baby and then start the treatment. But so that is
Yes.
very important. So,
Okay.
it is all related to the gestational age, the cancer. But the general philosophy would be to get the delivery done as soon as is possible and then start the treatment as far as the pregnancy related cancers are concerned. So, because the cervical cancer is the disease of the fertile women. So, obviously, during pregnancy, we are going to occasionally come across these patients who have got a pregnancy as well as who's got a cancer. So, as much as possible, defer the treatment till the pregnancy is taken care of and then start it. Of course, you have to weigh the balance. If you think that the cancer is quite spread and all, and then it is better to terminate. If it is early pregnancy, better to terminate the pregnancy and then start the treatment. But if it is late and you can wait for a few weeks or a month or so, then might as well deliver the baby and then as soon as the baby is mature and then go for the treatment.
Yes, sir. So, sir is recommending all the gynecologists to have at least one per speculum examination during the pregnancy, even if they complain, so that it does not miss a unhealthy or a bad cervix. And also, once the pregnancy cervix, cancer cervix is diagnosed in pregnancy, if it is near term, better to deliver and then go for the treatment. Early pregnancy and advanced disease, I think, better to terminate and then start the cancer treatment. So, sir, this is the last question. There is the other way around. Suppose if there is a woman who's a young woman of around 25, 30, or maybe 35, she has been diagnosed with cervical cancer, she is not married, or she wants to conceive later. So what about the treatment we give to this woman with a cervical cancer? What do you advise her to go so that her fertility is preserved later, and also her pregnancy? What are the complications can happen during her pregnancy if she has taken any treatment for cancer cervix?
Okay, so before I go and answer this question, I would like to also say that in one of the diagnostic newer tests that have come, a lot of artificial intelligence related, cloud related tests have also come. There's one test where you can now use a colposcope and you can just take a photograph of the cervix and export it to the cloud, and the computer tells you whether there's a danger of this particular woman having cervical cancer or not. So new cloud computing analysis tests are there now. Even pap smear and all can be, we can use artificial intelligence to do the pap smear reading. In abroad they already started doing it, and I'm sure that as our number, because India the number is very large. So once we are saying do this, do the test, do the test, do the, now once the people start doing the test, we'll come in a situation where we'll not have enough people to read the pap smear. So that's where the AI is going to come in. Just 2 days back, the new AI has come, chatbot CG at GHT, where the chatbot has even passed the MBA exam. So the chatbot AI has become so good that they will take over the reading of the test as well. So that's the one thing which is now coming in a very big way. And coming to the fertility, so basically in a young woman, fertility preservation. So if there is a cervical, obviously the treatment is chemotherapy, which damages the ovaries, or radiation therapy, which will damage everything possible around the ovary as well, the bowel, the ovary, the uterus, and then you may have the surgery where you can do conservative. You can just remove the uterus or do a conservative Vardheim surgery. But now there are new technologies that are also coming, so we can freeze the eggs. So oocyte freezing can be done, or you can freeze the ovarian tissue. If you don't have time before the surgery, you can go in and to remove the ovarian tissue and freeze the ovarian tissue, and then later on utilize surrogacy. So suppose the uterus is taken out, then if you have frozen the eggs, then we can create an embryo by the husband's, later on when she gets married, her husband's sperm, the frozen oocyte, make the embryo and put it in a surrogate. Because in our new surrogacy law, if the uterus is not there, by after taking permission of the medical board and taking a order from the magistrate, you can undergo surrogacy. It's not that government has banned surrogacy. What government has done is it has prevented lifestyle surrogacy from taking place. Just as a woman says, "Oh, I don't want to have a child, but I want surrogate." That is not allowed. But people like genuine people like such this patient where uterus is lost, or ovaries are, and then if the ovaries are totally damaged and you have not preserved your oocyte, you can borrow an egg. So you can do an egg donation also. And of course, obviously, there's always something called adoption. The problem is that adoption now is there's a lot of waiting list, and not people, children are by. That's a good news that not many children are there for adoption, which is good news because we don't want orphans and all. But so I think assisted reproductive technologies are going to be a good answer to these women. And remember, you must preserve your fertility because many of our doctors are not aware of that. So you as patients should ask for it. See, the whole thing boils down to awareness. Hello. In my campaign, what I'm doing is we need to do a lot of awareness. Awareness promotion is very important. Uh, uh, Not only about cancer, but about everything. And I feel that I've created a 12-minute cartoon film, which we all created, the FOGSI has created, and we are going to disseminate it, which tells you about everything from womb to wellness. That is, I can't call it womb to tomb, but womb to wellness, and 12 minutes. And so that is very important. You must tell patient everything what can happen go wrong with her, and
Correct.
in a
Yes, sir.
very less time period. Otherwise people forget. If you tell them 20 things and you take 9 hours to tell them, they'll forget. If you give them 10-minute information, they'll remember all that important information. That is what my conclusion is: awareness, awareness, and awareness. Like in the best way of having a very successful hospital or a restaurant is three words: location, location, location. Similarly, the best way for women's health is awareness, awareness, awareness. Can you hear me, madam? Hello. 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 Is there anyone there?
Sorry, sir. I think.
Hello. Yeah, yeah.
Yeah, sorry, sir. I think I lost the internet for 2 minutes.
Doesn't matter. That is how life is.
So, very well said, sir. So, as you told, the message for the gynecologists and the oncosurgeons and the young women who are planning a pregnancy, but who unfortunately are diagnosed with a cancer is that they have to consult a fertility specialist and talk about oocyte freezing or ovarian freezing, no, sir?
Right. And
Yeah.
later on they can also go for surrogacy if the Vardhan. I've done a lot of patients during my younger days before 2013 when surrogacy was easier. I have done
Mhm.
even patients from abroad where they had done Vardhan cystectomy and all, and they had
Mhm.
come and I had done I had done the ovum pickup. One patient I do a laparoscopic pickup because the Vardhans and they had transposed the ovaries up. So I had to do a laparoscopic pickup and then I made the embryos and I transferred and gave them a baby. But now again, surrogacy is not that it is not illegal or something. They have just regulated it. And people like this patients of young patients with cancer where they have lost their uterus, they can definitely go for surrogacy.
Yes, sir. So thank you so much for talking to us and talking to the public about the prevention strategies, what FOXI is doing, what the government of is doing, and what precautions doctors have to take and the patients have to take. So please tell me your take-home message to the public and to the young doctors and and the
So
what FOXI is doing or for prevention of cervical cancer, sir.
So basically, you have to basically the WHO strategy is that to vaccinate people early, to vaccinate, then test. testing is very important, and then early treatment is important, because in cancer now everything is early. So I would like to leave you with an exciting breakthrough that has come in. That is just like, in the cancer, early precursor cells, they leak into maternal circulation. So we can now collect the blood and try to isolate these cells and test them. So nearly 10 to 15 cancers now can be located using this new technology. It has got and this technology can tell you which is the organ from which those cells are coming. So even before the malignancy becomes clinically apparent, if you will be able to say, okay, this is coming from the colon, then you can start looking for the cancer before the cancer becomes clinically apparent. So just like we do a normal test of, say, blood sugar, or we do glycosylated hemoglobin to see mota if there is a diabetes or a thyroid TSH level, or we do a hemoglobin to see anemia, we'll be able to do this tests in the future. About 5-10 years, it will become more and more precise, and you will be able to make out where the cells are coming from,
That would be
preempt early diagnosis, and we'll be. So that is what Dr. Yuval Harari is a author who writes about the future, and he has said that the longevity of women is going to go to 150 years, because we'll be able to pick up the cancers very early. We'll be able to do the stroke management early. We'll be able to pick up cardiac problem by doing CT angios and treat them. We'll be able to do diabetes management, hypertension management, and we'll be able to prolong the lives of women. So much so that he has predicted that many women will start becoming pregnant. They'll get remarried at the age of 70, 75 and become pregnant again. So this is the future.
Okay. Yes, sir. Yeah. So that is amazing news you shared, that a simple maternal blood test from a woman or from any person can detect precursor cells of cancer in the body. That's very great, sir. Thank you so much for your most valuable time, sir. We know you are the FOGSI president and you're extremely busy in so many activities for the public and for the government of India.
Yeah.
We are all under your guidance. We are working hard to reach out to public. We are ready to do as many programs as possible regarding awareness locally, regionally,
Right.
and also for Thank you so
Right.
much for your.
So I would like to wish everyone, tomorrow is Republic Day, day after tomorrow, I think. So I would like to wish everyone happy Republic Day. And, we take care of your body. It's very important. And be preventive. Do more preventive work. Of course, indulge. You can't not indulge. Otherwise, you will not enjoy life. But enjoy it in regulation, in control.
Thank you so much, sir. Thank you so much.
Thank you, madam. Thank you. Bye-bye.